participants, scholars, researchers, food scientists, traders, peoples, food people from food industry, consumers, and many more. So we have almost 250 plus registration. So so far we are colleagues are adding. So let us wait a couple of minutes for most of the participants to join. So let's wait minutes. So while waiting, so let me tell something about the background of this program. So as you know that we all are facing this pandemic everywhere in the world. We are all facing very difficult time, struggling for pandemics, and all global citizens suffering from this pandemic. But the type of suffer, the degree and the safety net requires for the specific country is different, and that is obvious due to a difference in the geography, climate, economy, our livelihood style, culture. So always these kind of things. The safety net required is different for different country. So we believe that this kind of platform would be very useful for us to share the good practices our country is having, and also lesson learned from different part of the world. So considering this fact, Cornell University Institute of Food Safety, in collaboration with Nepal Development Research Institute, is organizing this Pan-Asian Virtual Office Hour in support of Purdue University and USAID Feed the Futures. So we would like to welcome in this program. Actually, this program includes one keynote speech from Cornell University. Dr. Aljosa is giving up keynotes from Cornell University, and that will be followed by country presentations by at least 11 countries. We are from 11 countries. So also we take this opportunity to take one group photo. So make sure that your video will works for the group photo, and after that we will enter into Q&A sessions, question and answer sessions. In that, all panelists will have time to discuss with the participants. So participants, and before we will enter into Q&A sessions, each panelist from the 11 country at least, we will request you to make your short presentation, country presentations about the pandemic situation in your country and the strategy your country is adopting and the challenges you are facing. So after that, we will interact with the participant from the different country, and in the end of the sessions, we will provide you information regarding the pandemics in different countries, especially a lot of resources from the Cornell University itself, in NDRI, and many more in your country. We will post the resources informations in the chat box. So this is the overall information about the programs, how we gonna organize this program. And finally, we acknowledge the panelists, participant, and supporting agencies. So with this slight small backgrounds, I would like to request Professor Dr. Aljosa from Cornell University to present. Yeah, yes, sorry, let me introduce our panelists first. Yes, the first speaker would be Dr. Aljosa from Cornell University. And then in the country presentations, we will have Dr. Latiful Berry from Bangladesh, Professor Dr. Latiful Berry. After that, also from Bangladesh, we have Mohammad Zakir Hussain from Bangladesh itself. And from Bhutan, we have honorable panel, Kinga Chiring from Bhutan. Similarly, from Cambodia, we have Chai Sims from Cambodia, Dr. Chai Sims. Similarly, we have from India, Anjani Kumar. Similarly, from India again, we have Angsila Sengar from India too. Similarly, from Indonesia, we have Dr. Harapan. Similarly, from Malaysia, we have Dr. Asita Angloe. Similarly, from Myanmar, we have Dr. Tetneu from Myanmar. So similarly, from Pakistan, we have Dr. Zaidas. And from Philippines, Jose Mercado. And from Sri Lanka, we have Dr. KKDS Ranwira. And as a panel expert, last but not least, we have a Professor Dr. Anil Kumar Anal from Thailand, AIT. Yes, yeah, and five of us are hosting this program. Myself, Jai Kumar Gurung, NDRI, Miss Rosina Shrest from NDRI, and Nirmala Acharya from NDRI itself, and Dr. El Josa, Dr. Elizabeth from Cornell University. 5 of us are hosting this program. So welcome all panelists, distinguished participants, guests, and host. Thank you. So moving forward, we would like to invite Dr. El Josa for his presentations and brief overview of the pandemics and especially in the food industry. So Dr. El Josa.
Thank you very much, Dr. Gurung. So Regina, are you going to share the slides?
Yeah, sure.
For me? I mean, I can do this if you allow me. I can also share my slides.
Yeah, sure. You can do that, Al.
I can do that?
Yeah, sure.
Okay, let's see. Okay, it works. Let's see. So can everybody see and hear?
Yeah,
we can.
Okay. Okay, so I don't want to take too much of your time, but we thought we would maybe start with this short presentation just to set up the stage for the discussion. I think the discussion part is what's most important. So we wanted to just point out 3 points when it comes to COVID-19 and food safety. So number one, we would like that all of us are agreed that COVID-19 is not a foodborne disease and that COVID-19 does not represent a direct food safety risk. So we will look into some of the key points why this is so. Number two, because procedures and time needed to control COVID-19 in food facilities is something that was added on top of everything else that we do to make sure our food is safe and nutritious. So it was inevitable that this extra time and work that was taken away from our regular procedures of ensuring the food is safe, that this would have this indirect impact on food safety in a negative way. So we will also look into some of these issues so you're aware of them. And then some positive note under the bullet number 3, we will look into how many of the procedures we implemented to control COVID-19 in the food facility also had a positive effect on controlling actual food safety risk. For example, wearing face masks, more attention to washing your hands and surfaces, all also reduce transmissions of foodborne viruses, for example, norovirus, not just COVID-19. So if we start with the first one, naturally, when this pandemic started, consumers were really concerned with food being a transmission vehicle. And you can see today, still there are people that are kind of skeptical about it. But if you look at what CDC, FDA, World Health Organization, European food safety authorities, agencies in Australia, New Zealand, all over the world, most of them you will see that they have a similar opinion, that there is actually no evidence to suggest that COVID-19 is transmitted through food. And that this virus is actually very fragile outside of the host and will survive, not for a long time outside of the host. So why is it so? First of all, if you look at the structure of SARS-CoV-2 virus on the right side, so the virus that causes COVID-19, you'll see that it has on the surface this fat layer, which is not very stable under conditions we find outside of the host, like low moisture, high oxidation stress. And it is even less stable when it's under acidic conditions or in presence of detergents. And we know that most foods are acidic. The surfaces where food is made and prepared are constantly cleaned with different detergents. So all in all, not the best environment for this virus. And this is also probably the reason why none of the foodborne viruses we know today have this structure, just because you need, this structure is not good enough to assure survival in something like food. If you look at foodborne viruses, like on the left side, you can see that they have in their structure this coat made out of protein. And this protein coat gives them this higher stability. So foodborne viruses like norovirus and hepatitis A have much higher stability outside of the host. And probably this structure is maybe the main reason why foodborne viruses are actually foodborne viruses. As a comparison, if we look at half-life of one and the other, so the time needed for half of the virus that's present in food or on the surface to be inactivated, when we look at foodborne virus like norovirus, the half-life would be measured in weeks. If we look at half-life of SARS-CoV-2 virus, it would be measured in hours, maybe in days, which is much, much shorter. For example, one study showed that half-life of SARS-CoV-2 in water droplets or on surface of materials made from copper is only 1 hour. So every hour, this virus is split by half, which is pretty fast. Another point when it comes to stability, I wanted to say is that how long a virus will survive outside of the host, for example, in food or surfaces, strongly depends on how much virus is on that food or on that surface in the first place. If you start with low number, indicated with the green arrow on the left, the time needed to inactivate all of the virus particles will be shorter, so indicated with the green arrow on the right. If you start with a higher number, the time needed will be longer. That's indicated with the red arrows. So even though if you look at the graph, the inactivation rate between the two examples is the same, so the lines are parallel, but just because you start with a high concentration, it takes longer for all of the virus to be inactivated. Now, if we talk about SARS-CoV-2, first of all, we are expecting contamination to be very unlikely. And if it does happen, to be very, very low. So people are not going around sneezing and coughing directly onto our food. Maybe a likely scenario that can happen is maybe infected person touches their face and then touches their food, maybe that apple in the store. But the transfer rates, when this happens, for example, transfer rate from face to your hand, from your hand to that apple, are very, very low. Basically, we would expect less than 1% of contamination going from face to that apple, which combined with this low stability of the virus that we talked about, ends up not being enough virus reaching that susceptible person to cause an infection, which is still why, we still don't have this evidence of this type of transmission, because it's very, very rare, even if it does happen. So it is better to worry and protect yourself from getting infected directly from that infected person, instead of worrying and getting infected from food or contaminated surfaces. So just to recap this part, so food contamination is unlikely to happen. When it happens, it's unlikely to be high. And then we have this unstable SARS-CoV-2 virus that's unstable outside, which is all very consistent with epidemiology of this virus. If you look at the epidemiology, the pattern of how this virus is spreading is consistent with the respiratory virus, because this is a respiratory virus. Today, there's almost 170 million cases globally, and we actually still don't have any actual evidence to say, yes, this is a foodborne transmission, because it's not. If we go to the next point, we said COVID-19 is not a direct food safety risk, but it can infect a lot of other factors that assure our food is safe. So all these can lead to indirect negative effects of COVID-19 on food safety. So let's look at some of these points. So number one, we all heard about supply chain disruptions. So the disruptions at multiple stages, and one stage is that was affected is the supplies and ingredients. So the same way we can have problems shipping our product to our customers, our suppliers have problems shipping ingredients to us. So maybe we have to find other suppliers which are maybe less verified, less reliable. Maybe they have to, or definitely they have to ship from different locations. And all of these things introduce new factors that can negatively influence the quality and safety of ingredients that we are receiving. And then again, just because of this pandemic, we have less time and resources to make sure that what we are receiving is safe or what it should be. There are also overall transport limitations present because of COVID-19 that prolong transportation and increase the likelihood of something going wrong. For example, less effective refrigeration because the cooling breaks down in the long transportation. And finally, there's also food frauds, because certain ingredients are just not available during this pandemic. And this gave opportunity to all types of tricks and frauds. For example, we know cutting of spices with other chemicals, that can actually be also hazardous to human health, like different illegal dyes or heavy metals and so on. The next point are disruptions to actual food safety procedures in production, in processing, retail, service business. So like we said, all procedures we have in place to protect employees from COVID-19, like face coverings and social distancing, cleaning surfaces, screening employees, all these had to be added on top of everything else we do. And we didn't add any additional workers to do this task. Assisting workers had to take these tasks on top of everything else that they do. And maybe it can be even worse because of COVID-19. The workers get sick, they have to isolate at home. Some get into contact with positive individuals, they have to quarantine. So oftentimes we don't just do extra work with the same number of people, but with less people. So naturally, this workload, that causes, workers to burn out and not being able to do just basic tasks, let alone additional tasks that COVID-19 demands. Then, even if the company hires new workers, there's often, these workers are oftentimes less experienced in, just basic food safety practices. They go through faster training. And even when they do receive training, it can be challenging, and less effective because we have to keep that social distancing. We're wearing face coverings. It's harder to communicate. So all in all, it's harder it's all affecting this food safety aspect on a indirect level. So if we go to number 3, so the inspections and audits are also being reduced during COVID-19. So inspection agencies are definitely not going to send their inspectors into facilities during pandemic unless, you know, it is very, very necessary. So me personally, I used to be an inspector in Canada, and I know that when, you know, inspection agencies are not present in the facilities, the procedures in these facilities can, let's say, loosen very quickly. We implemented this remote inspections, and these did help, but oftentimes this physical presence in the facility is sometimes probably, it's really needed, you know, to maintain that certain food safety standards in the facilities. And then lastly, the consumer. Consumers also changed their food safety practices. For example, a lot of people had to learn to cook again in US. You know, a lot of people were used to eating outside in different restaurants at all times. And because, you know, the restaurants had to shut down, the consumers started eating at home again. And a lot of them didn't have sufficient knowledge of what are some of the food safety practices that protect us from getting foodborne illnesses. Another example are the chemical intoxications caused by consumer overreacting to COVID-19 risk. You know, the reports to poison control centers in the US have definitely increased during COVID-19 because consumers, you know, overreacted and disinfected all surfaces, including food, you know. So naturally, there were intoxications with bleach and other chemicals. So just as a note, you know, cleaning your fruits and vegetables under cold running water is sufficient to clean them. You know, there's no need for any additional chemicals to be used to wash your fruits and vegetables. Now, the last one, maybe a positive side, did COVID-19 strategies have any positive effect on food safety? And could these strategies, if we keep them after this pandemic is over, maybe help us also in this food safety arena? So we put together this infographics where we list control strategies by how we see them as priorities. So this doesn't mean that these priorities are the same in all places or situations. Maybe, you know, situation in Nepal is different, maybe situation in Bangladesh is different, but this is how we see them for this US environment. So number 1, definitely getting all your workers vaccinated, very important. Then social distancing, wearing face coverings, screening workers for COVID-19 symptoms, frequent hand washing, avoiding touching your face, and then cleaning and disinfecting surfaces may be less important, but definitely important is when you are thinking about your control strategies to think about the COVID-19 spread in the community as the last part. So now, the same way we see benefits in vaccinating workers against COVID-19 and protecting other workers from COVID-19, maybe we can take the similar approach with vaccinating against foodborne viruses like hepatitis A, and then protecting, you know, both the workers and consumers against this foodborne virus. So the same way we emphasize social distancing, the face coverings, frequent hand washing, and cleaning surfaces to control COVID-19, maybe we can also emphasize the same procedures to control a spread of foodborne virus like norovirus, you know, among workers and consumers. And finally, the screening procedures and controlling the community spread of COVID-19 was strongly supported by giving this sick workers their paid sick leave. So they didn't have any problems, you know, reporting that they are sick and staying home, you know, just because usually if they didn't get paid sick leave, you know, they would just keep working sick because they were, you know, they didn't want to lose their income. So maybe if we continue after the pandemic, giving this paid sick leave when people feel sick, you know, and keeping them outside of the workplace, maybe this way we can also reduce transmission of other diseases that can represent foodborne risk to the consumers. So finally, we believe that this, COVID-19 pandemic and food industry around the globe, they were forced to build this COVID-19 control culture, because we all had to kind of work together on a common goal to protect our workers, and by protecting our workers, also protect the consumer. So now maybe next step would be, after this pandemic is over, to take this COVID-19 control culture and transform it into a food safety culture where we all work together towards the safe and nutritious food and satisfied consumer. So just to recap, so again, COVID-19 is really not a direct food safety risk, but through many disruptions it causes in our production, it can have this indirect negative effect on food safety. And then finally, many of the control strategies we implemented to control COVID-19 can be used to control food safety risk now and in the future. Just to finish, so this virtual office hours are made possible by the generous support of American people through United States Agency of International Development. So Nepal Development Research Institute is organizing this session in collaboration with Feed the Future Innovation Lab for Food Safety, which is a joint partnership between Cornell University and Purdue University. And with this, I'm going to finish, and thank you very much for listening.
Thank you, Dr. L. Nice presentations. So this gives an overview of characteristics of virus, and I'm sure you might have questions to Dr. L. So please post your questions in chat box. So we will discuss on that, and also taking a permission of Dr. L. If you are interested, we shall share the presentations in also. We can send you the email. We now enter into country presentations. So, before we invite invited panelists to present, we take our privilege to present short situation of Nepal, the current situation and how we are trying to manage it. Well, Nepal is also, hard hit by second wave of coronavirus, as you know, and rate of spread is very, very high in the last almost 3 weeks. And now, so far, the total cases is almost 500,000, and death almost reached to approaching 7,000. And active cases is 100,000, 100,000. And the test is very limited, almost only limited to 3 million so far. So the prevalence could be even more. And Nepal is, suffering from the big shortage of medical supply, such as oxygen, ventilator, hospital bed, and situation was very chaotic. It is still chaotic in many urban area, both in rural area as well. And government has appealed for the international supports, and Nepal is receiving international support also, and thanks to all those who are supporting. And definitely there is a big impact in the food systems, food chain, entire food chain. So maybe I would like to request Nirmala Acharya, who is a food science, related to agriculture, to describe how this COVID is having impact in the food chain. Nirmala ji, could you briefly talk on this? Nirmala, can you hear?
Yes, sir. Thank you. Well, the COVID-19 pandemic is further increasing food insecurity in Nepal. The entire food system of the country is hit by a major shock due to the pandemic. the food demand declined because of limited market opening, closure of restaurants and other food services, and mass migration from cities to villages as well. Moreover, scarcity of agricultural imports like seed, fertilizers, feed compromised food production here. The supply chain of fresh farm produces is severely disrupted, accompanied with price hikes. Furthermore, reduced demand and disrupted supply chains is leaving farmers no other choice but to let their harvest rot in farms. Farmers, traders, and consumers are facing challenges to follow food safety protocols. Likewise, lack of adequate surveillance from concerned authorities is further aggravating the nationwide fear of virus transmission through food intermediaries and food products. Nepalese people are under stigma and misinformation about COVID-19 virus transmission through food and are with questions like, does food carry virus? How food producers and food products should be handled to prevent COVID-19? I hope we will learn lots of best practices necessary for managing the pandemic by agro-food sector from this virtual office hours today. Thank you.
Thank you, Nirmalaji. Definitely, we look forward to hear from many countries, and definitely we would like to adopt the best practices you have. So that would be useful for us. Thank you, Nirmalaji. So we enter into now country presentations. The short presentations, we have invited for a short presentations. Definitely, you will have more time for the discussion sessions. So we start from Bangladesh and Bangladesh to last eventually Thailand. So before we start country presentations, definitely we have a time limit. So Rosina here is sharing, informing the all panelists, distinguished panelists about the time, how we are, allotting you about the time. Rosina, can you quickly inform? Yeah.
Oh, yeah. Hello, everyone. Regarding the country presentation, we request all the panelists to please complete their presentation in 4 minutes. And panelists who are using PowerPoint slides shall present in minimum 4 slides, which will be focusing on the country-specific status of COVID-19, challenges of COVID-19 that your country is facing, and its coping strategies. And to keep our time, we will alert you before 30 seconds of your 4 minutes to be over, saying 30 minutes remaining, and we will request you to stop your presentation when your 4 minute will be over, saying time is over. Thank you, sir.
And thank you, Rosina. We are sorry that we will have an elaborated presentation maybe in the other sessions later on. So we'll start from Bangladesh. Rosina, please share the host to all panelists also. And Professor Dr. Latiful Barry is presenting from Bangladesh. Dr. Barry, your
yes,
4
thank
minutes
you.
time starts.
Thank you very much. Can you hear me?
Yeah.
Oh, that's good. Thank you for inviting me for this presentation. So I will give you a brief introduction about COVID situation in Bangladesh. In Bangladesh, already second wave have been gone, and now we are facing problem with the Indian variants surge in this country. And if you look at this, slides, and you see that the rate of infectivity is 13.5%. Now it is a little bit less, but again, it is jumped to 17% just today. And almost every day we have 40% died on an average, 40% died in recent days. And the impact is very severe in this country. And if you look at this age limit, age bar, that 60 above population has the main problem. And then we have little problem with the students are 10 to 11 years old. But this COVID virus now that is surging now in recent recent week, we have seen children are mostly affected, and that's why we're very concerned on this. And if you look at this slide, the Indian variant that comes here on 8th May, we have got first Indian variant that is on May 8th, and after that it is little bit growing more and more. And in the border area, especially on southern and northern border of Bangladesh, we have about 55% or 90% infectivity in this particular area. And that's why we locked down there for 7 days and see the condition, what will happen, whether it is improved or not. And you see this virus is mainly transmitted through droplets. Droplets generated by the people when they cough, they sneeze, they talk, or they cry, something like that. So, but as Dr. Ella just said, there is no evidence associated with food transmission till today. And why? Because this virus cannot survive much more time outside the host, because they do not have a protective coat, and that is the reason, that is the difference between foodborne viruses. Like foodborne virus, they have a protective coat, and that coat helps them to bind on the surface. But this virus doesn't have a protective coat. Instead, they have spike protein, and that helps to bind them in particular places of the human respiratory system. And it's very small in diameter, and it is a crown-like spike. That's why it's called coronavirus, as you know. And the main impact, as Nepal slide shows, is mostly like that. In addition to that, we have a lot of problem with the food businessman and small food businessman and street food businessmen are the worst affected in this pandemic. In addition to that, large industry also, they are using half of the workers to produce the food by maintaining the social distance, by giving them hand washing supplements and mask. And that's why production has some limit, and that's why price is high nowadays. And you see, we have government strategy, all these strategies are in place, but the thing is, nobody is caring. People actually doesn't want to listen to the government. And that problem we have in this country, and we are trying to make the people understand, please do this, do that, but nobody is hearing. And you see that this is a crowd during Eid vacation, and people all are gathering together. Nobody has mask, nothing. In the village area, almost like this. And we have, if you want to get more information, you can get here, DG Health, Directorate of Health Services in Bangladesh. They are the authority for giving all the information to the public. And thank you very much for my presentation.
Thank you, Dr. Barry, for brief presentations. So we now move to north for Bhutan. So Honorable Mr. Kenga Churing is presenting from Bhutan, from Institute of Happiness, IOH. Mr. Kinga.
Thank you, Jaya. Thank you, Nirmala. Can I have my slides put up, or would you like to make me host so I can zip through the slides?
Nirmala, can you display?
Can I share the slides from my side?
Yes, yes, sir. I will just share it.
Okay, I'm okay.
Okay.
I'm trying. Okay. So is the slide shared or?
Yes, sir.
Sir, your screen is shared, but the slide is not in the proper form.
Okay.
Shall I share for you?
No, it's okay. So I don't think, in the interest of time, I'll just go over, what I have to share. So anyway, thank you so much, everyone, for this wonderful opportunity to participate in this very important international forum. In the update from Bhutan, I just wanted to call it as the Bhutan's COVID and food security response, primarily in maybe under three topics. One is the COVID, then I said culture and the comparative advantage. And the reason is, while we know that, I realize that even from this group, I'm the only one who is not a scientist. So therefore, I tend to bring the cultural approach on this whole response to COVID. And the main reason is, I think we have been fairly fortunate in terms of being, keeping the COVID cases very low. I think we have only about 1,500. We have only one known death because of COVID. And as of now, there's very, very little community transmission. But we do have some, and especially as our colleagues were sharing, now since the cases are exploding in the neighboring countries, so we are a little bit concerned about that. But one of the things that I wanted to share here is because we have been fairly fortunate and have been very successful in this response, and especially when it comes to the very basic necessities in terms of food security, is the leadership that is provided by His Majesty the King. In the slide that I shared, actually, we have a picture of His Majesty deep in the jungles under a shack with a mineral water, just trying to, let's see, we're trying to share the slides. Anyway, the main thing is, our king is personally making sure that he's keeping everybody safe. Yeah, this is the picture. So I was saying that just as the myth, we also have the reality where the king of the country is actually in the jungles trying to protect the population. And next slide I just wanted to share was, can you go to the next one? Yes, some of the things is that the king has actually provided the most generous stimulus plan, which is called the Mosquitoes Relief Fund. And in that, there are three components. So can you go to the next one? Interest waiver for all the loans, unemployment benefits, and the third one is the food security. And here, if you go to the next slide, I just wanted to share that one of the most successful response has been His Majesty has actually trained over 20,000 young people in Bhutan over the past 10 years. And to this day, nobody was able to fathom actually why His Majesty had that vision to train so many young people. And of course, we are a very small country scattered all over, mountainous terrain, very difficult to reach the villages and so on. But the fact that we had 20,000 people trained by His Majesty, we had one person trained personnel for every 30 population in the country. So therefore, the response in terms of food delivery, in terms of taking care of the basic necessity was very, very fast and efficient. And I think that again goes back to the vision of His Majesty the King. If you go to the next slide, please. So this is where His Majesty started back in 2011, almost 10 years ago. And we are reaping the benefit of this vision now. Next one. Next one. Of course, this I think is very common to all the countries. But one of the things, again, distinguishing features is that our quarantines are 21 days, not 14 days. Right, and 72 hours for the goods and full evacuation of Bhutanese from abroad. So no matter where you're from, you're almost, we have to evacuate them and bring them home. Next. But the whole thing is comparative advantages. Can we turn this around? Because Bhutan is very, very far away, remote area. So therefore, whatever we produce, even in terms of food, we have to import a lot from India and other countries because of the lack of comparative advantage in Bhutan. But because of the COVID challenges, can you use this actually to turn it around? Yeah, so maybe the last one is, the last slide, next one is, yes, GDP contribution from farming and food is only 17%, but employs about 54% of the population. So maybe despite the challenges and the difficulties we are facing, this may be an opportunity for us to turn it around and really provide food security to the nation. Thank you.
Thank you, Honorable Dr. Kinga Chiring. for very fascinating presentations. The cultural approach of managing the COVID, really impressive. So congratulations. So we move to, we go down to south, now Cambodia. So Dr. Chai Chim.
Good afternoon. Do you hear me?
Yes, yes.
So thank you so much for inviting me for joining this office hour. So now I just would like to show some brief about the COVID-19 and the food industry in Cambodia. Next, please. So this data I would like to show about the case in Cambodia now is the total around 30,000 cases, and the normally is we can recover. This one is around 20,000 people is already recovered. However, during that situation, we have around 200 people already dead. So this actually we call is the third wave of COVID-19. We call 20 February. So this kind of that overview. And other one, I would like to share the vaccine. So actually the total, the first dose around 2 million actually. So these are actually we already vaccine to the people. So for our target is around 10 to 15 million people. This is our target for the take the vaccine. Next, please. So in this picture, I just would like to show that in our case, in our Cambodia case, we don't have the specialist, or we cannot identify the COVID-19 yet. So we use the name the specialist from other country. Next, please. So for the COVID-19 transmission, actually there are two. This is the main transmission. So from the contact the people who have COVID-19, and for the respiratory. So these two cases is the two cases that we call it the major that transmission COVID-19, and the other two is the less. Please, next, please. So the totally we can say that is food COVID-19 cannot transmit through the food. So what we are do in our country for food industry that we are practice every day. So in this I would like to show three technical that we are use. The first one we call technical measure. Technical measure in the company or in the restaurant or retailer, they install the hand sanitizer at entrance or the area, and we use the information how to wash the hand, how to wear the clothes, how to wear the cover, and how to clean, especially for hygiene, good practice hygiene. So, and that's also we just saw the board that COVID-19 symptom, and how to prevent, how to stop the spread of COVID-19. Next. So for organization measure, so we have three. The first, we remind all the staff that work in the food industry to control the COVID-19. We not allow them to go to the ground people or the somewhere that have many people. That's one. And other also they allow the staff to stay at the company. And other one they use so yeah, just one slide. So at the personal hygiene, before they enter the company, we need to screening, and we promote to practice social distancing and properly hand hygiene. And the last one is we wear the mask or the wear glass. Yeah, thank you so much.
Thank you, Dr. Chai-Sim. Actually, yes, time is short. Nevertheless, this session is especially question answer facilitated session. So we would like to hear first before we enter into discussion. Few country specific some approach, new approach, if you have any. So we are very sorry that to allow you for short presentation, but we will discuss later that one. So thank you, Dr. Chai-Sim. So we now go into West, now India. So may we request Dr. Anjani Kumar for your short presentations.
Yeah, good afternoon, sir, and thank you for making me the part of this important deliberations. I will speak since time is short. I'm not using PowerPoint. So like other countries, or particularly our South Asian country, India is grappling with the second wave, and real impact of COVID-19 are still unfolding, because first phase we have relatively managed well, region as a whole. And the story of COVID-19 so far is both of resilience as well as vulnerability of the food system. If we look at the impact at a broader framework, macro level, there has been substantial reduction in the employment, means unemployment rate has gone up. There was vulnerability was apparent in terms of food security, in terms of higher incidence of food and nutrition insecurity. There has been several disruption in the supply chain, processing, food industries everywhere, but agriculture as a whole, not only in India, but even in other countries of the region, managed well. In India, it has grown at 3.4%, which is a kind of impressive agricultural growth. And in fact, agriculture has emerged as a savior of economy, and in spite of the contraction of economy by around 6.4%, which is the latest estimate. But still we are having a lot of challenges, and the policy action and also delivery mechanism of the food safety net programs have ameliorated the adverse impact, particularly the support system like public distribution system, PM Kisan, and a lot of fund transfer that has helped a lot. And the delivery was kind of hassle-free, and more than 90% of the eligible households got those benefits within a very short period of time. And we need to take a lesson from these experiences, these pandemic pains, and the recently announced budget. If we look at from the government of India, more emphasis on climate change, more emphasis on health and nutrition, that pose a confidence that it would be a long-term commitment to address these kind of challenges in the future. And food safety, as far as food safety is concerned, I think both sides, supply side as well as demand side, they have encountered a lot of challenges. Supply side, earlier there was a lot of disruption in the manufacturing processing sector, and also at their own, many people might have not felt to work during that kind of pandemic. So there was shortage of laborers, there was shortage of that. And demand side, now more and more emphasis on the compliance with food safety measures, and consumers are looking for better compliance of food safety measures for the food commodity. And this is, in fact, the COVID-19 has renewed the debate on compliance with food safety measures at each level of the value chain, from production to consumption to transportation, everywhere. Yeah, just I'm finishing. So this is the kind of impact, but as I mentioned, there was negative adverse impacted, but there was a positive line that we have come as a resilient society, and emphasis on food system as well as this food safety will increase in the future, because it has created a lot of awareness. COVID has created a lot of awareness about the practices which we need to follow. Thank you very much.
Thank you, Dr. Anjani Kumar. Yes, we understand big country, big issue, big challenges, right?
Yeah.
And requires a big strategy. So many country, we all are following you, how you are managing it. So thank you, Dr. Anjani. So we move now to southeast further from Indonesia. So Dr. Harapan, is Dr. Harapan here?
He's not here with us now, sir.
Oh, okay. So if he's not there, so we switch to next. We go for the southeast. Okay, to Malaysia. Okay, from Malaysia, Dr. Asita Elengwe is presenting. Dr. Asita.
Okay, thank you, sir. Okay. Good evening to everyone. So, okay, on 25th January 2020, I think our first case detected in Malaysia. So I think go to the next slide, please. Okay, so it's detected in Malaysia and traced back to 3 Chinese nationals who previously had close contact with the infected person in Singapore. So they traveled from Singapore to Malaysia. And currently, MCO, the movement control order imposed starting from the 12th May until 7th June. Currently, you can see here the chart, the numbers here as of 25th May. Total active cases is 63,458 and 726 people in the ICU and 373 people needs the ventilator. And as of the 25th May, there are 2,369 death cases are already reported. Okay, so the virus is normally transmitted by the droplets or mainly by the airborne like coughs and sneezing. Actually, the 3 most dangerous mutant strains like the B117, B1351, and B1617.1 already detected in Malaysia. B117 is on the 11th January 2021, and the second strain is on the 1st April, while the last one, Indian variant, is already detected on the 21st April. And 1/3 of population already registered for their vaccine through the MySejahtera application or the website where they can register for their vaccine. So can we, okay, the impacts. So the people start to avoiding go to the stores and the face-to-face. So they prefer use online or the home delivery to get their food like GrabFood or Food Panda. And farmers try to use the online application to deliver their vegetables, fruits directly to the food consumers. And the people are more focused on the function and origin of food than the price and the brand. Because last time they want to, okay, I want rice, this brand, but now they just want, okay, just grab the price only. So they didn't see the price of brand. And second, the third thing is they try to buy in the food items in the bulk to avoid the product shortage. For example, when the first MC 1.0 implemented, so the people got panicked. They rushed to the supermarkets. You can see the picture here. So long queue, so they want to get their things. So after that, the government like put like limitation, like one person can buy only like 1 packet of rice and 30 eggs per person to ensure the food supply. And high demand for the instant frozen foods like sardine, Maggi, and bread. And because of due to the closure of the schools, there's no canteens. And since the overseas transportation was interrupted, the import food has also been affected. So this will increase the food prices. So what happened? The poor people cannot afford to buy the foods. So companies like work only on important tasks to maintain their business activities like production, ordering, and customer care. And then they try to put like ship factory production lines to make sure there's a stable or constant food supply production. And research and product development is affected because multiple people need together. And after that, they also late in their release of the new products. And order adjustment also happened due to the shortage of some products. So next slide. So how they manage the food during the COVID-19 pandemic. So like they allow only 2 people from the household to go out to buy necessary things within the 10-kilometer radius of their house. 2 people means including the driver itself. And like the convenience stores, restaurant shops, and food stores and food truck, and the roadside hawkers food court, everything like they reduce the operating time to 6 a.m. to 8 p.m. So only takeaways, drive-through or delivery are allowed for the food services from 6 a.m. to 8 p.m. There's no dining allowed. So daily markets, morning markets, and farmer markets can operate from like 7 a.m. to 2 p.m. with a strict SOP. With the strict SOP means they need to wear the mask, scan their temperature, must record the attendance in the book, and then wash their hands and hand sanitizers, maintain the social distancing. So Rayla team means that there's a team always outside, they monitor the crowd in the market. So they will give like a token.
Over.
Okay, 50. So they enter 50 tokens. So only like 50 people only can enter in the market. So if anyone come out, then only another person can go in. So like wholesale market also maintain the same operating time like 12 to 6 and 11 to 4. Okay, and then in factories they thoroughly manage the hygiene. Okay, and then there's also sports shacks and restaurants and supermarkets who do not follow the SOP. They will have a impose penalty. And the final, like the government welfare interfere to deliver the food to the underprivileged groups. Not only welfare department group, they are voluntary groups who also deliver the food to the hospitals and poor people. So that's all for my presentation. Thank you.
Thank you, Dr. Asita. So we realize that the food management issue is everywhere. So we are not only the exception. So thank you, Dr. Asita. And the SOP, the one you have prepared, might be useful for we too. So we may request you to share that if possible. So thank you, Dr. Asita. Now we move north to Myanmar. So Dr. Tetneu is presenting from Myanmar, from University of Technology, Myanmar. Dr. Tetneu.
Yes, sir. Good afternoon, sir.
Yes, now, yes.
Good afternoon, sir. Can you all hear me?
Yeah, we can hear you, Dr. Tetneu.
Let me share. First of all, I am very much thankful to NDRI for inviting me for this event, and I'm very glad to be part of this event. Now let me give a brief presentation about the COVID-19 situation in our country. So let me share my slide.
Tetneu, any problem?
Yes, sir. I'm sharing my slide. Can you see the slide?
I cannot see. Maybe Nirmala, maybe you can share for her.
No, sir. She hasn't provided.
Okay.
You may go ahead without sharing as well, ma'am.
Yeah, maybe yes. We can hear you clearly. Yes, Tetneu. You can present. We can hear you.
Yes, sir. First of all, I want to tell about the COVID-19 situation in Myanmar. And today I will in overall situation, our country have started in our country very fast. COVID positive cases are on 23rd March of 2020. So that two first cases they started in that early March, and then second wave has again in our country has supposed that second wave started in September 2020. That is in the north part of Myanmar, that is Rakhine State. In that part, second wave started. And overall, till 12 May 2021, and 2.9 lakh of vaccine, 29 lakh of vaccine doses have been administered. So according to Worldometer records, our country has, in 26 May, our country has 22 active cases, and total confirmed cases is 1.4 lakh. Among total confirmed cases, there are 3,216 deaths are there. So total cases per million population is 2,618, and total test is overall total test is 26 lakh, and total test per population is only 47,000. And our country total population is 54 million, that everybody knows. So, and this is overall situation. And in our country, transmission pathway is the very first cases of our country are from returning from foreign countries like UK and US. So those are very first cases in which reach to our country. After that, from those people who return back from foreign countries, then contacts are during transportation. If at that time public transportation are not stopped that time in our country, so they use public transportation from them. And then one religious function, the biggest cluster started. This started in our country, and after that, the family member of those people who are already COVID positive cases. And now let me tell about some control strategy. The government of Myanmar has formed national level central committee to tackle that disease. And in that, Ministry of Health and Support is the lead position. And that committee has announced to cancel all public events and ban public gatherings. And for government staff, civil staff servants are ordered to do 50% work at home and 50% work in office. And university and schools were closed. A restaurant, tea shops, beer station, they are allowed only takeaway. They are not allowed to take dine-in taking. And crowded public transportation were also stopped. And wet markets, particularly in urban areas, they are ordered to use protective measures such as daily deep cleaning, wash facility, and some social distancing measures. So impact on livelihood. Workers from cloth industry are lost their job during shutdown of garment factories. Laborers from hotel, restaurant, tea shop, and beer station, they lost their jobs mostly. And but good thing is people become aware of taking hot and boiled food, organic vegetables, homemade food, and people are avoiding outside food. This is good impact. And losing job are bad impact. And the challenge is, unfortunately, our country is weak in healthcare and standards. So this may lead to our country not only health problem, it may lead to social unrest, and violence may also come. So this is the challenge we are facing. Thank you for the presentation.
Thank you, Dr. Tetnew. Yeah, thank you. Actually, the cultural and festival, balancing with this, adopting this, culture with the, to face the challenge of the COVID is very obvious in every country. So thank you for sharing this. And as you said, due to political turmoil and a lot of issues are there. You said in the pre-meeting also, so that is also challenging. Internet regulated, so communications also. You said, and that is challenging. So thank you, Tetnew, for sharing about your country. So we go now towards far west. I mean west from Myanmar to Pakistan. From Pakistan, Dr. Jaidas is speaking he's a Aga Khan University, Pakistan. So may I request to invite Jaidas. Jaidas, can you hear us? Hello? Dr. Jaidas?
Your mic is muted, sir. Dr. Jaidas.
Dr. Jaidas, are you having some technical problem? Jaidas, can you hear us? We are not hearing you. So while you will be fixing, shall we go ahead and then unmute? Rosina, maybe you need to unmute. Rosina?
Yes, sir. Jaidas, sir, you are not in a mute.
Okay, so Rosina, please help Dr. Jaidas to fix the technical problem. So while doing that, we can hear the next presenter from Philippines while fixing this problem. Small issue, technical, this often happens.
Can you hear me now?
Yeah, it's okay. Yes, Jaidas,
Oh,
Dr. Jaidas, it's fine.
sorry for
Yeah,
this
no,
confusion.
it's no
So,
problem. Yeah.
okay. So, can you share my screen?
Yeah,
Okay, it's already there. Great. Okay, so first of all, hello everyone, and thank you so much for this opportunity. Without wasting any more time, I'll just begin by highlighting what was the trends of COVID in Pakistan. And if you move to the next slide, we can see that the first case in Pakistan was seen in Feb 2020. After that, there was a slow rise in the number of cases, and this was mainly because of there were preemptive actions taken from the government. There was a strict lockdown across the country, and all of the national, international borders were closed, except for, and all of the industries were closed except for food and medicine. So these lockdown restrictions were then relaxed by mid of May, and as they were relaxed, Pakistan saw the first surge of COVID, which peaked in around end of June. But it subsided, and after that, the government did apply any national lockdown, but there were some smart lockdowns in areas which had a high positivity rate. Pakistan then had a second phase from November to January, and currently we are going to the third phase, which started from March, but there still haven't been any major national lockdowns apart from smart lockdowns in the areas which have a high burden or a high prevalence of disease. If we move to the next slide. This COVID-19 and the subsequent lockdowns had a serious impact, economic impact. As we can see, half of the population of Pakistan is dependent on agriculture or livestock as a primary or a secondary source of income. According to the Bureau of Statistics, the consumer price index increased during this time, and these increases were higher in the rural areas compared to the urban areas. There was a rise in food inflation also, and which was also higher in the rural areas compared to the urban areas. And the cost of production during this time also increased due to suspension of flights, the border closes, wastage of perishable items, and there were issues with supplies and logistics. Next slide, please. So what we see was what were the various factors or impacts of COVID-19 on food system. And we see there was an increase in food prices, there was a decrease in food trade, due to logistics and storage capacity issues. There was food access issues. There's imbalance between consumption and demand. There was evolution of food prices. There was restricted movements due to border and internal border closures. There was, because of this, there was late sowing and cutting of crops. There was a spread and contamination. Apart from this COVID-19, there was also contamination of desert locust, which also occurred in the summer last year, which also had an impact on agriculture. And all of these measures led to a loss of employment and income opportunities, and led to disrupted food supply chain. Next slide, please. So what we see was that although there was a greater hit on the GDP, but if you see that the food systems or agriculture were relatively spared compared to other sectors. And if you move to the next slide, we'll see that if you compare the agriculture with the other sectors, we see that the greatest impact was on the services sector, followed by industries, and agriculture was one sector which was impacted the least. Next slide, please. So what we see was that even the farm households, what did they experience during this lockdown phase and during this COVID-19 pandemic? So they did have a loss in wages. There was reduced food consumption. What we saw was that the family members returned home from urban and rural phases, and there was reduced non-food expenditure also. Next slide, please. So what were the mitigation strategies taken by the government? We saw that there was a large cash incentive program, one of the largest in the world, in which the government provided 12,000 Pakistani rupees to each household. And this was provided to roughly 12 million households across the country. Then there were support packages for laborers, in which people who had lost their jobs were provided cash incentives. And then they were also relocated into other government initiatives, like Pakistan currently has a large tree plantation program. So most of the farmers or people related to the agriculture who lost their jobs were accommodated there. Then there were subsidies at utility stores. These are public sector grocery stores where there are subsidized food items for the poor and marginalized communities. Then initially there was a ban on export of food so that we don't face any shortages of food. The government also provided subsidy on electricity and relief package for industries. There was wheat provided support to farmers for sustainable supply of wheat. And agriculture package included subsidies on pesticides, fertilizers, seeds, tractors, and they also reduced the markup on loans and allowed delayed in loan payments. These were some of the measures taken by the government to mitigate the impacts on food industry. Thank you.
Thank you, Dr. Jaidas. Actually, your government's effort is very appreciable. You know, compared to what we have, actually such a stimulus, any incentives in our regions. In case of Nepal, we are not being able to do that. So thank you sharing about your country, Jaidas. So we now going to east to Philippines. So Dr. Jose Mercado is presenting from Philippines.
There. Hello.
Yes, we can
hear me.
Yes, we can.
Okay. So thank you very much. First of all, on behalf of the Food and Agriculture Organization in the Philippines, I'd like to thank NDRI, of course, Dr. Jaya, thank you, and Nirmala for having me here in this event. Now, next slide. Okay, so first, what's happening now regarding COVID-19 in the Philippines? We have, as of May 25, 1.188 million cases already. We have the second most number in Southeast Asia, and we have breached already the 20,000 the number of deaths. And we're saying that the number of daily infections, we have a peak of 15,300 just this April. But this has gone down. And just last May 25, it was around 3,972 per day. And but we are still above the 1,700 cases in last year. Okay, that was the average. Now, they're saying that the cause of the increase in the daily infections in the Philippines is mostly is also caused by the entry of the different variants. So next slide. There. So now we have like other countries that have been affected by COVID. We have the UK variant. Yes, the UK variant already, the South African, the Brazil, and the latest is the Indian variant that was detected in India just this May. And we also have our P.3, which is a local variant, although this is not yet classified as a variant of concern. So it's not really that bad yet, but we're trying to contain that. So next slide. Okay, so what is the impact on the food industry? Of course, like in other countries, there was supply chain disruptions the start of the pandemic, and this was remedied right away by the Department of Agriculture issuing the food pass and implementing what we call this Kadiwa program. Now, the objective of this Kadiwa program is trying to bring the produce of our farmers closer to the consumer. So that solves a lot of problems about the people going out, and of course it works both ways. The farmers have their markets because again of the lockdowns, they could not bring in their produce. So this Kadiwa is a project of the Department of Agriculture and the local government units, usually the municipalities or the townships, or towns. Okay, so it's a fiscal structure provided by the local government units. So the farmers bring their produce there, and people from the towns go to this fiscal structure and they buy. Okay. So it helped it helped that people do not go out far away from their places of residence. So, and because of the mitigating factors, the lockdowns, this has caused very badly the lower the purchasing power, because a lot of people lost their jobs, and because of, again, they could not buy, so go to the market. There is limited market demand. Now we say there's a cautious optimism in this sector because households always prioritize food. So and again, the Philippines is the food industry in the Philippines is aggravated by the problems with natural calamities. We have 20 typhoons in a year, and we have El Nino, La Nina, and stressors on the food industry. Okay, so that's ASF, is African swine fever, the avian flu, and the FAW is the the fall armyworm, the pest of corn. Next slide, last slide. Okay, so control strategies adopted. The Department of Agriculture issued the guidelines on food safety, and we're going to institutionalize the Kadiwa, initiated by the public sector, by the government, which eventually should be taken over by the private sector. And like in what was mentioned by, I think that was Pakistan, provision of agri inputs, so there's seeds, fertilizer, in our plant program, and there are soft production loans available for the farmers. And most recently, the strategy taken by the government, because of the lockdown, the government's trying to bring in more pork. Okay, so the tariff has been reduced, and the minimum access volume, that there is now more pork coming in. Okay, so well, in short, that's what's happening now in the Philippines. So thank you and good day.
Thank you.
Okay.
Thank you, Marcado, Jose Marcado, for sharing from Philippines. So many challenges. Yeah. And yeah. Okay. And so thank you. So we now go to Sri Lanka in West. Professor Dr. KK DS Ronveria is presenting from Sri Lanka.
Yeah, hi to everybody from different countries. I'm very much thankful for giving me this opportunity. My presentation will have major points like overview of the COVID as far as Sri Lanka is concerned, and then virus characteristics, what is at the moment we are facing it, and then transmission pathways, and also impact of food industry. So these are the things. And nowadays we have hit by the UK variant B117. Now it is predominantly spreading the other lineages also. So therefore, it's a very serious situation in that sense. And as per experts' view, this new strain is airborne, and its droplet can remain in the air for about 1 hour. So, and also it's more very highly transmissible than any other variant we found earlier. And as of now, we have already infections. We had 160,000, about 160,000 cases, and so let's say now it's reaching to 170, and then our daily new cases about 3,000 per day, and at the moment active hospitalized patients are about 30,000. It means we have also higher recovery rate, which is very good point. And also we also have very low fatality rate. But this third wave has been very severe in this case. I'm not going to into more detail about the bigger picture of food industry in terms of taking precautions to minimize the spread. But I would like to focus on a couple of points. Now, everybody is now aware that wearing mask and sanitizing, so these are very important things. And in terms of food industry, if it is affordable to have periodical PCR test has been recommended. And also in previous presentations, it was mentioned that food is not a vehicle to give the transmit virus, but it's for us it's too early to conclude that way. Therefore, better to take precautions. Actually, consumers are very much fear about the possible transmission of virus through food. Therefore, a food industry anyway is compelled to take precautions. So, as precautionary measures, to restrict eating in working places, and also giving a separate room for eating, like, and also okay, and so then especially introducing many herbal preparations like coriander, like turmeric, cumin. So these are the things also now people are encouraged to consume while they are in work, and also coming from home and also going back to home. So they are recommended to okay, precautions, take precautions to stop any possible transmission. Thank you very much.
Thank you, Professor Ranvira. Presenting from Sri Lanka about your country, how you are trying to manage, and it's really appreciable. Now, finally, last but not least, from Thailand, Professor Dr. Anil Kumar Anal is presenting. So, Professor Dr. Anil.
Good afternoon. Can you hear me?
Yes, sir. Yes, sir.
Yeah, I think Nirmala or Ozina, anybody, you have my slide. Can you share?
No, sir. You can share yourself, sir, because we didn't get your slide.
I sent at the last. I sent actually. Wait, then.
Yeah. You can go ahead. You can go ahead by sharing yourself, sir.
I got problem. Okay. Okay. Can you see my slide?
Yes, sir. Not at all, sir.
Okay. Thank you very much. Thank you very much, Jai sir, NDRI, and all other organizers for giving this opportunity. Thank you again, and it is very pleasure to see all the people here. I'll not take too much time. I'll try to be very precise, talking about what in Thailand, because we have been listening for many countries. And I just saw in this slide, not looking for the global picture, what is happening for the food securities, nutrition securities, or hunger and the situation. But obviously, like other countries, even the Thailand has a lot more resources, agriculture resources. Still, there are chances to the increase of, you can see that the insecurity towards food and nutrition, like from 9% to jumping to the 11 to 12% of the people, that is more likely to coming after the second wave. I just give you a little bit background here of the Thailand. Like, you know, the Thailand has been the last year when it started in February, March, there were the cases there which increased, but very precisely, or you can say that some sort of, I don't say lockdown, it was never happened, the complete lockdown, but partial lockdown works very well. And the people were very much conscious here, follow the regulations, like we have been listening in many countries that those times the guidelines are not listening. People are very much aware that what to do and what not to do, so try to. And by now we know that it is more from the people to people infections are there. But somehow the inflow of the people from the other countries as well, that is still happening. And that makes the second wave, there were, during the wheat market, it started sometimes coming from the legal, the migrant workers from where that happened. Okay, sorry. Oh, you are sharing again? Hello?
Yes, sir.
Okay, I was sharing as well. Okay, thanks. So I need to tell you. So what I was talking is that the Thailand, so that's the case. And then you can see that we have the third wave, which came last month, and that is still continuing there. And at the rate like around 3,000 cases are per day. The death rate is still low here, around 1,000, getting 140,000 is total in the range of from the last year till now. But there are a lot of stray diseases going up, and that is hopefully to work. But with that, that is affected on the whole farm systems due to some partial lockdown policies, you know, that and major effect is that the people have, you know, the Thai culture is very likely that the people go out and eat. It's not like cooking in the home. So that is disrupted, and that is affecting a lot throughout the supply chain and reaching up to there. Can you go to the next slide, please? Okay, the government here and what I look here, the safety regulations, I will not go for all details, but what is the strategically is moving is very nicely trying to make more on the eliminate of the causes. And then if you see there here in the COVID-19 or such type of virus, elimination is first to remove the hazard, and then you are coming the control, especially on the hygienic design, isolating the people, changing the working behavior, follow the standard policies. These are the major things, obviously, which is likely to, and that is happening very well in all the industries, starting from the farm up to the going to the market, there, even in the supermarkets or the surrounding markets, or you can see in the roadside vendors, they are following very nicely the regulations. Next slide, please. Okay, this is just saying that I'll not go to detail. Go to the last slide. That will be much better for me. How the Thailand has been coping. Here, I would like to spend a little bit time to 1 or 2 minutes. I'll give what Thai tried to do this in a pandemic situation. Let me start with the first Thailand 4 strategy, which is more like here. The Thai government is aiming to have innovation for the food hub of Asia, as well as the kitchen of the world. That is the slogan Thailand government has started. With that, they like to have a lot of communities from the Western society up to the everywhere to bring a lot of opportunities how to promote the Thai foods and that bringing to the Thai industries. With that, Thai government has initially, even you can see within 4 months, a huge investments have been created there, especially 5.84 billion baht, which will be continuously, especially spending on the advancement of their hygienic designs, making the people more aware, the medical facilities with the food industries, as well as on the supply chains. At the same time, they are also looking for how the research and development innovations can be created with a new type of food materials, like focusing more on the plant-based proteins. There are a lot of ready to eat, the frozen food, how to make that you can supply to the consumers likely. The seafood market is very big here. Similarly, other livestock. For the COVID-19 management, obviously the main impact is the food business and factories could remain, and the supply chain is still continuing. So what is the main idea was to do there is in the frontliner, all from the farm up to the industries where the frontliners, workers, this should be protected more as well, like health workers and others. So they have been started already in the mass COVID-19 vaccination, though it has been a bit late, it's coming here, but it has been started already. And if you can see that many of those wet market and in the industries, they have been giving all the protections, not only the vaccination, but like I mentioned, I emphasize here how to isolate the people, how to make the people without locking the industries. Their industries has not been locked since last year even. From the March, it has been open all the time. But how you can manage that the production is not getting reduced, because like Thailand is supplying almost 80% of the seafood to the US and Europe and other countries as well. So there is a need that one as well. And more is the Thai culture itself. Like I mentioned, Thai culture is like that. If you go to the anywhere, you can see that people have all the time mask. Like you can see me, I am wearing even in office alone. I'm carrying this mask all the time. And this culture is very much here, which the people think. By now we know that this virus is not coming through the food. This virus is not coming. This virus is coming from the air, from 1 to 1 person, which has been known earlier and which we should believe actually that is coming there. So how to protect, even like going to buy the food in the market or to the vendors or outside vendor, like I mentioned, the Thai people more likely to go to the outside and eating their cultures. So that helping a lot more the people that one person, you save yourself, you save others. That is the slogan the people have, and that culture is working. Okay. With that, I think I'm done. Thank you very much. If you have any question, I'll be happy to do.
Thank you. Thank you, Professor Dr. Anil Kumar Anal from Asian Institute of Technology, AIT. So thank you for giving a very insightful information, sharing about practices, best practices of Thailand. So thank you all panelists and giving a wonderful reflections and the facts and informations from the 11 different countries. In fact, 13 different countries we are here, 12, at least 12. While the panelists were presenting, I saw a lot of inquiries and communications, your inquiries, and also a few responded by Dr. L, Dr. Beth from Cornell University. In fact, both they have been working, especially in the food sector, Institute of Food Safety, Cornell University. So I request all to also save this communication, so and those might be useful for all of you. So before we now enter into the Q&A sessions. So as per schedule mentions, we would like to have a photographs, group photographs. So so may we request all of you to open your video so that we can have a short video short. I see here Rosina and other colleagues, Nirmala. So we request to take a photo. Also Beth, Dr. Beth.
Yeah. Yeah, we request everyone to please open up your video so we can have a quick photograph of all of us.
Sir Don?
Yeah, yes, sir. Thank you very much.
Thank you.
Thank you, everyone.
Thank you. Thank you, all of you. Definitely, we will share you the photographs also. You shall directly write to Nirmala or Rosina, who are holding the secretariat for this virtual office hour. And now, yeah. So as I said that we have a lot of questions and inquiries in the chat box also, and we have received a lot of hundreds of questions from you all participants while registering. So just to start the Q&A, we would like to, we have picked one most frequently asked questions. So we would like to start from these questions. The questions is, can COVID-19 be transmitted through food? So this is very simple, but many people, there are still confusions. How to answer? Many panelists also mentioned clearly, Dr. L also mentioned these things. But can any panelist or may I request Dr. Barry just to start? How do you respond this
to this question?
queries?
Okay.
Yeah.
Okay. Thank you so much. Can COVID-19 be transmitted through food? This is the question, right?
Yeah.
So usually these COVID-19 virus, they are very unstable outside their host. That means outside human host, they're very unstable. And till today, we do not have any epidemiological study that say that has been transmitted through food. So by this, we can say that this is not a foodborne pathogen. That's why they cannot be transmitted through food, but they can stay for a while on the food, but it's very difficult to transmit through food because this COVID virus is designed, that means is natural characteristics is to transmit through human to human. Because this virus has a spike protein, and foodborne virus, they do not have such spike protein. Instead, they have one protein coat over there, and that helps them to bind in the food. That's why they are foodborne pathogen. But COVID-19 is not called a foodborne pathogen. Since if you go to the definition of virus, virus cannot survive without living host. This is the definition. So that means a food is not living, so they cannot survive there. But as I said, they can stay there for a while. For a while, it's very unstable and very quickly they die. And this is why we cannot say that virus can be transmitted through food, this virus particularly. Do you understand?
Yeah, thank you. Thank you. So there are a lot of questions. Nirmala, can you read one most frequently asked questions and others? Yeah.
Sure. Here I have a question to Dr. Zakir from Bangladesh that can COVID-19 transmitted through ticks or mosquitoes?
Well, thank you for asking me the question and giving me the opportunity. Well, like Professor Barry already said that it's transmitted from the infected people to a people, or it can stay in a surface for a while or for the long time. So if anybody can touch the surface, he can be contaminated. So this is the way what we know already, that how this virus is transmitted. But this virus is a zoonotic. It was from the animal that jumped to the human, you know already, but we don't know the zoonotic case, who is the host there. But till now, there was some study also, but there is no evidence that the mosquito can transmit this virus from the mosquito to the human. It is not possible.
Thank you.
Thank you. Thank you, Dr. Zakir. So, El, do you want to say something? El, you are muted.
Sure. Yeah, I unmuted myself. Yeah, sure. So I wanted to say, so it is very important for this virus to be able to infect another person. So getting in contact with just a single virus is not enough to infect a person. You need to reach that infectious dose in order to infect a person. So the only way this can happen is if sufficient of active virus is like you are challenged with it, you get exposed to it. So the only way to do that is to really have that close contact with a person. So person speaking, talking, coughing, there are droplets coming out of their mouth, out of their nose. And usually the ones that carry sufficient quantity of virus are the ones that are in the big droplets that naturally fall down to the ground within those, whatever, 1 meter or 2 meters. That's why we do that social distancing. We stay apart 2 meters because that's the zone where most of those droplets are coming from that carried most of the virus. So that's why we do that. We also put our face coverings on, so we limit at the source, those droplets coming out. So that's how the virus will infect you. If you don't wear your face coverings, you don't keep your social distance, that's where it's going to happen, because you are going to be exposed to that fresh virus coming right off infected person's body to you. As soon as you introduce this intermediate step where, from infected person, it goes onto a surface, then a susceptible person takes it from the surface and takes it to their face. That's already a lot of steps where the concentration is reduced, the virus is not stable, it's inactivated. So this is very much less likely scenario to happen, going from surfaces to a person, going from food to a person. The risk is so much higher getting infected directly from that infected person that's actually the part we should worry the most. We should just cover the highest risk, which is person-to-person contact, those respiratory droplets. And if we do that, we're not 100% safe, but we are very, very safe, putting a lot of effort into, protecting ourselves from getting infected from surfaces and food. It's taken too much energy out of us. It's better to invest all that energy into rethinking how we can protect ourselves from other people.
Okay, thank you. Thank you, Dr. L, clarifying this. I'm curious to hear from Bhutan, but I didn't see our Mr. Kinga there. So, culture and culture means crowd in case of Kinga, are you there?
Yes, I'm here.
Oh, okay. So, culture is crowd, for Asian people, for us. And you are applying the way you are managing the strategy is, applied in your country. Do you think it is possible only small countries, less populated country like yours, or do you have any, ideas for a country like highly, densely populated country like ours or Bangladesh or India? Do you have some idea?
Yes, I agree with you, Mr. Jaya. For example, yesterday was the Buddha's Purnima holiday. So a lot of people would like to go to the monastery. They would like to congregate. And I think this is a hugely, a very risky affair. So the way that we try to use culture is in these kind of things. We appeal to for example, the chief abbot, and then also the religious leaders to come out and then also share that, in face of pandemic, not necessarily that we have to prove our loyalty to our culture and to religion by, doing something which scientifically would be very, very damaging. So that is one aspect I wanted to share. So the basic value and belief that people have in the religious heads, religious figures, and the leadership is very much still intact. But we need to use the religious figures to come out and then share with the people saying, look, even though it's a very sacred day, it doesn't mean that you have to go out to the monastery and then pray like usual. It's okay. No matter where you are, even if you are at home or you are in the middle of the forest, it's perfectly okay that, these are some very trying times. So it is okay to be isolated and not congregate together. So even the other issue is normally in Bhutan, the funeral cremation of somebody loved one in the family. It's something, where all the neighbors, we have to come together like everywhere else. I think same in every culture. But this time our chief of the Buddhist religious head, J. Kembo, he shared saying that, why don't you limit it to 20 people? You are in fact doing service to the late loved one who has passed away by observing this COVID protocol. So that is the shift that we wanted to share, saying that, culturally is very strong, but at the same time, I think you can use the same culture to, in fact, convince the people, saying that you need to change, you need to adapt because of the challenges that we are facing now. And the other one is belief in the leadership in terms of culture. Again, that's why in my slides, I've shared that we sincerely believe, because of the hardship we are having in such a difficult terrain, that always the leaders are sent through some divine intervention, and everybody is listening to His Majesty the King and following all the protocols. There's no disturbance. When there is a national lockdown, all of us try to follow it to the letter and to the law. And I think this has all helped us a lot in terms of using culture effectively to respond to the pandemic.
Thank you, Kinga. In fact, this is what COVID is telling us, that this is a multifaceted, issue, and we need to put all approach together to make a one comprehensive, smart package that includes science, leaderships, culture, religion, like you said. So I think this is very useful information. We have here Anshila Sengnar from India, a young research scientist from India. Are you there? Anshil Sengnar from India. So we'd like to hear, is there any possible way to,
Yes, sir, I'm here. Yes,
yeah.
sir. Just
Okay.
a minute.
Yeah, can you can you try to connect, cultural approach for, in the remedy of this, I mean, managing this COVID in India too? Do you see any possibility?
Yes, so pardon, please, your question.
You mean Dr. King has said that cultural approach has to be integrated. So
Yes.
do you think it's possible in India too? India is a very cultural rich country.
Yes, yes, sir. In India, the cultural diversity is very much, as we know, every aspect, every state has different culture and religion over here. So here, India, in the Corona time, in the COVID times, we are the religious practices are also to be followed. We have to lock the temples, we have to lock the churches, and we have to say to the people that stay at home. And because culturally, the God and the deity which we pray, they are just inside us. If we follow the COVID protocol, that's the only thing we can do the religious practices more and more, because help to people is the more important in this time than going to the temples or the religious places. So
Thank you.
yes, we have to follow the protocol in the religious sector also in India too.
Yeah, thank you.
Can I just supplement, Anshul?
Sure,
Yes,
sure,
sir.
sure.
Yeah. So yeah, we all know India is a diverse country and a lot of problems, lot of issues with compliance. But yes, culture
sir.
and religions both have come up with innovative solutions also to.
Yes, sir. Hello.
Not hearing.
Now online, even funerals, the prayer meeting for the peace of the departed soul. These kind of things are evolving online, and in fact, even though we gave permission to organize Kumbh Mela, but later on when the situation became worse, it was just kind of symbolic. So it was evolving, and some of the mismanagement which took place because of our lack of appreciation for the situation. It's not that cultural or religious rigidity, because in every temple, everything was, but in the long run, we have to open up, because it has also multiplied effect on income, employment, livelihood. Even in all countries, religion is also providing a lot of livelihoods.
Economic,
So
yeah.
economy. So that also have to keep in mind, and while practicing the COVID protocol appropriate behavior. Thank you.
Thank you, Nanko. Here I see one questions probably from India. One practice. You also can see in the chat box. Can dipping fresh produce, fruits, and vegetables in turmeric powder mix warm water destroy virus particle attached over it if they are received from COVID positive persons? This is in the rural practice in South India. Can any
Yes,
of
I can answer this
okay,
question, because
Barry, okay.
That either turmeric or ginger or onion, it doesn't have it does reduce microorganism, but since, as I told you before, the virus itself is very unstable on food, on vegetable, or whatever it is. So you don't need anything except just water wash is enough to kill this bacteria. Or you can just left the vegetable just for a while, for 1 hour, so that you can say that no bacteria is there. You don't need anything to do, especially for food that touches by a COVID infected person. That perception is very, very, very clear. Because if you have clear idea on this virus, you don't need to think about, because people, they are misguided actually.
Yeah, lot of
Washing
misinformation.
something like that, and that is very dangerous. And even sometimes they mix together, turmeric plus any other sanitizer. That is dangerous also. That can produce some toxin. You don't need anything. Just wash with clean water. That's fine. No problem.
Thank you. Thank you, Dr. Barry. A very short question to Dr. L. in Asian country, there are a lot of myths, that do not have any scientific evidences. Like we discussed turmeric, ginger, and other many herbals. Our Prime Minister, a month before also said the same thing, and that really made a lot of confusions. And people are still following that. And a lot of people had suffer just relying on that only. Is there any scientific study or considerations that your country, US and other and other regions where science is well advanced, for if there is any supports from this kind of herbals for managing this coronavirus?
Yeah, so all the scientific data that's available, it's, I think, available to all of us in the same way. Going through the currently published material, there's really nothing that I found that would specifically, show like a controlled study where they, tested infections when using one or the other spice. I don't recollect any of those kind of studies. And based on that, there's no way we can recommend anything. I think the important part is to just think about how you can keep yourself healthy, just in general, so eating healthy, eating diverse food to get all that, vitamins and nutrients and minerals into you. So your body is healthy, your immune system is healthy, so you can fight off any infection that's out there. So, instead of, that infectious dose being, 100 virus particles, in a healthy body with really good immune system, maybe it takes 1,000 to get infected. And that makes a huge difference. So, yeah, it's
Thank
just
you, Dr. Al.
Stay healthy.
Yeah. I'm curious, you are running both Al and Beth, you are running this virtual office hours since long in US and many countries, right? Dr. Beth, is there any, what are the most FAQ people are asking from your country? Dr. Beth, can you highlight? Can you give us?
The most FAQs? So I think the frequently asked questions have changed throughout the pandemic. And so we did start early on in the pandemic a year ago. Really, the main focus was, can COVID-19 be transmitted through food? And I think we were able to establish early on that that's not the case. Now, a lot of our questions are focused more on the vaccines and how the vaccines work, and how we can help to maybe increase vaccine acceptance. And then what do we do moving forward as more and more people do become vaccinated in the US. So I think that these are questions that as we do get more vaccine distribution, I know we haven't even really touched the tip of the iceberg with getting the vaccine out there across the world globally. So I think that those will be some of the questions that we'll be beginning to see in the future as we do get more of that out there. But really, the Institute for Food Safety, we have a compilation of all of these frequently asked questions that have been asked during our office hours up on our website. So we can share the list there. And you can see there is a diverse range of questions that we got. And a lot of them went from, is food safe, to how does the food industry really cope with implementing some of these control strategies within their food facilities to keep their food employees safe and healthy. And then, like I said, now we're moving into sort of the how to handle vaccines and vaccine distribution, and encouraging people to get vaccinated if they're eligible and it's available.
Thank you, Dr. Beth. Thank you. So you are true that here in our region too, the frequently asked questions definitely changing over time, and many people are now talking and trying to get vaccines, and that is the most important that people have considered. Dr. Ranavir, so how about your country? Timely restricted the air, the air flight and everything, and your country itself is isolated, right? So, do you see any immediate impact, that help you, your country to manage COVID, being isolated? Yeah.
Yeah, I think earlier also you asked question whether the gatherings, whether help, or actually being an island, we managed to face COVID-19 successfully in 2 waves, first and second. Then all travel restrictions were there, so therefore we managed to keep it under control. But now, actually, this particular, we are having this new strain from UK, B117. That is from, we got tourists from different part of the world, and we got it. And because that was a problem. So being isolated, yes, fine, but you can't leave it like that. Anyway, we had to do our businesses, tourism, and so on. But only thing, then we also introduced this air bubble concept. There we managed to confine that into small circles. That is one thing, but it means anyway, we are compelled to associate with other countries also. Therefore, we can't restrict that bit. But coming back to this cultural events, now third wave, we now entertain is due to this gathering, because we had New Year celebrations in April. So then people's gathering affected a lot. Now we are having consequences of it. It means the other one I want to make also now. No matter gatherings can be how big, but there's a very specific risk time, because we gather maybe with wearing mask, but all of a sudden we remove mask and dining or taking meals. So that particular short time will be enough for us to transmit the disease. So these are something that we have to take into consideration.
Thank you, Ranveer. How are you? I'm curious. How is challenging to manage the physical distance in case of Bangladesh, which is populous country in the world? Professor Dr. Mohammed, can you mention shortly how is the challenges there, physical distance?
So we have like 160 million people, maybe it's more. So it's very difficult, especially like our capital in Dhaka. So within small space, there are like more than 20 million people are living there. So it's very tough to maintaining the social distancing. The thing what I want to include actually with the previous question with Al-Jus also, like we already know that the COVID-19 is it's transmitting from the infected people. But I think most of the things are related with the host immunity. So if you are more healthy and if your immune system is working well, then everything is goes well. Even the high load of virus maybe not can act something like that way that the unhealthy people have. So in the previous question, there was a question, sorry, I merged with the previous question also, that there was a question like the turmeric or other things can help or something like that. I think the functional food also can have some rule also. Like, the developing country, we have the small amount of vaccination opportunity. Like for Bangladesh, only like 2.38 million people got the vaccine until now. And there is it's challenging also to get the vaccination. And for the country like Bangladesh, the crowded people, all the developing countries, we are facing the same problem at a time. And it's very tough to maintaining social distancing, and it's very tough. The weather is very warm here. It's yesterday we here around like 38 degrees or something like that. So wearing the mask also it's not always easy for us also here. So I think together with this practice and like social distancing, wearing mask, we can also, like already Al Josa said, that the good food, I mean the nutrient contained food or the functional food, that can also act as a supplement to prevent from this COVID-19, I think.
Okay, thank you, Dr. Hussain. We can. Its time is almost finishing, so we will. We can discuss.
Can I add one point?
Yeah, just before. Yeah, before we hear you, we would like to request all the participants to contribute to complete the post-survey form that our colleagues will post here. So those post-survey form is very, very important for us to see that how this session was useful to all participants. So we would like to kindly request all of you to complete the post-survey form. So Ranbir, a very short answer.
Yes,
yeah.
In fact, now, as far as functional foods are concerned, so bioactive compounds can be one of the ways out to strengthen our immune system. For example, now in tea, in other fruits, quercetin is a very wonderful bioactive compound, which can also act as an antiviral agent. Likewise, all functional foods may help us. And also antioxidants we need to have more through fruits and vegetables, and also pigments like carotenoids in pumpkins and carrots and so on. So these are very important areas that we can strengthen, and even in food industry to introduce this kind of things as a new foods. I think it's a good way of getting the business off ground. Thank you.
Right. Thank you, Dr. Ranbir. Yes, yeah, a lot of questions I have seen in the chat box. Probably it's not possible to discuss here today all, but definitely we will communicate with you, and also we will try to prepare a FAQ as far as possible. We also have done in the past also with Cornell University few, but we'll try to make a FAQ. And I see one important, very frequently asked questions, the transmission possibility from money, that is in the link of the response from Cornell University has been posted by Rosina here. You shall have a look on that. Dr. L, could you please, how we going to use the pre-survey and post-survey form for analysis? Could you please mention that in 1 minute?
Yeah, so we introduced this pre-survey and post-survey just to see where just general public is in regard to the knowledge about COVID-19, the strategies of how to protect themselves and others around them. So we just wanted to see, what is the impact of this office hours? So how much knowledge do people have before the office hours? And do they learn anything during the office hours? So, when we look at these surveys, we then know, are there any gaps in the knowledge? Maybe next time we do this office hours, then we can focus on those topics that are maybe missing. So we're trying to, just have people know like a complete story about COVID-19 and how to protect themselves.
Thank you.
And thank you very much for filling out the surveys.
Thank you, Dr. L. So we request again for all participants and panelists to contribute to complete the post-survey. Dr. Beth, could you please mention a little in 1 minute how resource you have collected in Cornell University, country, in global, information resources you have. Dr. Beth, could you tell us?
So we, I think we've mentioned our website a couple of times. So we do have a website. The link is in your chat box with some international resources. From there, you can also access the rest of our website. I'll added a couple more resources here in the chat for some of the resources that were shared during Al's talk, the how to prioritize these COVID-19 control strategies in the food industry, and that shows both what employees and employers can do. We also have a food facility COVID-19 strategy checklist that might be helpful. So we just would encourage you to go ahead and check out our website and view some of the resources. As a reminder, we do have those frequently asked questions posted in English. We also have some that are being developed in other languages in Asia. So we have some that are in Nepali, and we might be getting some more in some other languages. So you can check that out. And then I would just add that under our food industry resources, we do have other templates and trainings, as well as a COVID-19 management training program that's under development, but we do have some modules that are being posted as they're being developed. So if you're looking for training materials for people who are working in your food facility programs, or for people who work on farms, you should check some of those out. And I think that's about it in terms of our resources. Thanks.
Thank you, Dr. Beth. I'm sure those are very, very useful, and at least our team found those informations very useful. And like Beth mentioned, we are translating few into Nepali too. And this kind of interface we found is very, very useful. Interface between the scientist and the key stakeholder peoples who are working in the food industry and in other sectors. So finally, we would like to thank you so much. It's already 2 hours plus for all panelists and participants. And I see almost 150 plus participant here. It was very great learning from all of peoples from 10 different countries. And we thank you, the distinguished panelists. You are very respected people, and you gave 2 hours time. And this is, contributions for all those who are suffering from COVID in any part of the world. So thanks to all scientists, panelists, and participants. And thanks to Feed the Future, USAID, and especially thanks to Cornell University, who encouraged us to organize this very useful events. So thanks to all. So El, may I request Dr. El to close these programs, and thanking all.
Thank you very much.
Thank you very much to everybody that joined us. I'm really happy everybody was willing to kind of prolong this session, just because the discussion was so rich. Like Beth mentioned, the resources we collected through this more than a year on our webpage are very useful. I would definitely recommend everybody to visit the webpage. But in general, thank you again, everybody, for joining us, and I hope to see you all in the future, and maybe we can continue this discussion in the future.
Thank you, everybody. Thank you. Namaste.
Thank you.
Thank you.
Everyone.
Keep safe, and be healthy. Thank you so much. All right, thank you.
Thank you.
Everyone.
Thank you very much.
Thank you, everyone.